Hello guys, this is just me just trying the camera, testing the camera to make sure everything is in order. So YouTube is live, Instagram is live, and Facebook is live. Hello guys, thanks for joining. Thank you for joining. Hello guys, thank you for joining. So welcome back to today's show, and in today we're gonna be talking, for disregard my background, a lot of folks working in the background, they don't listen, they've got plenty of time to finish their tasks, but they are busy. So today we are going to be talking about CPR. So I've got this bit here set up, and today is going to be an interactive section. It's not like one of those serious sections that we do. And I'm going to briefly be talking about what CPR is all about. So, it says here. So we're talking about CPR is important because it keeps the heart, it keeps human. Oh. So quickly, guys, I'm just gonna today okay, so now some people will be wondering, today we are talking about the importance of, let me type this quickly, importance of CPR and then what it does. So this is about me, then description. I need to add a description, guys. No? Okay. So what then? Of CPR. So guys, so we are gonna join me live as we discuss practical and effective strategies of CPR. So in this section, we're going to be talking about what CPR is all about, and then we're going to go deep down what is all about, its importance, and how we can use that to save a soul. So in this live, guys, we have just gone live, and then hello guys, thanks for joining my live. Thanks for joining. So, like I said earlier on, we're going to be talking about the importance of CPR, why it's important in our everyday life, and then what we intend to achieve. Viewers may not hear your voice. I hope the volumes are all okay. To be sad, the folks are not hearing me. Hello guys, I hope you can hear me clearly. Hello guys, I hope you can hear me clearly. So today we are going to be talking about CPR. I don't know, there are no folks in the room. Oh, hi, thanks for joining. Today's section, we are going to be talking about Control V. I think Control V is paste, eh? Yeah, all right, that's fine. So, thanks for joining. I'm just looking at the cameras, guys. So if you see me looking around, just know I'm trying to acknowledge people that have joined, and I'm trying to capture all the screens, if that makes sense. So today we are going to be passionate about a particular topic that means a lot to everybody, and that is called CPR. Okay, so CPR, like we all know, it's and we'll go into it in details in a minute. So comment sent with stars will appear here. Oh, that's amazing. Thanks for joining, guys. Thank you for joining. So we normally do every weekend, guys. Hello, Chantel. Hello, Daughter of Zion. Thanks for joining. So I'm just gonna write in the description box. We are going to have a chat about what CPR is all about and its importance. Okay, CPR is all about. Hi guys, thanks for joining my live. Thank you. I sincerely appreciate you guys. Um I'm just been hello. Hi AJK, AGK Favor. Thanks for watching. Hi. Nice one. Thank you so much, guys. So we're gonna start straight away, guys. The music is too much. We can't hear you well. No. Oh, sorry. I'll fix that. Sorry, guys. Oh my god, the music is too much. Is that okay, guys? Is that better? Hello?
And transparency have become non-negotiable.
The music is too much. We can't hear you. Oh, you know what? I know what the problem is. I'll fix it in a minute, guys. Okay, I'm running a different live as well, so I'm gonna put everything on pause. Yes. And then I will go back to my. Is that better? Can you hear me now? The music is too much. We can't hear you well. Is the volume okay? Oh, yeah, she said yes. Okay, that's fine. Thank you. All right, guys, thanks for joining my live again, and thanks for bringing that to my notice. Oh my God, else I would just be speaking to myself. So today we're going to be talking about CPR, and like I said, it's a very important topic that everybody needs to know, because CPR is not just for medical doctors and nurses or health professionals like us, but it's something everybody needs to know. When I mean everybody, every adult in the house above the age of 18 should be able to know what a CPR is. And you are knowing it not just for yourself. Hi, Favor, nice. Thanks for joining my live. I love you so much. Hi, Tukumbo. Thanks for joining. Oh, this one just joined and just disappeared. It's okay. Saturday morning, I understand. So now, today we are talking about something that is very single. It's something that is oh, so people like folks are just joining and just disappearing. Maybe it's not what they wanted. Anyway, that's absolutely fine. You don't have to stay, but it's a very educative section, guys, that you need to take home. If you've got a pen and paper, please do well to jot things down. It's really going to help you. It's going to help you to save a soul for people around you, for your children, for your loved ones, for your elderly parents. So it's very important you stay tuned and watch the live. So, like I said, thank you for joining again, life once again. So, CPRO saves a life. It's all about saving life here. So, what I mean by saving life here, you need to understand what the science of CPRO is, and then why we need to. IOJ underscore. Thanks for joining. You joined last week as well. I can remember your name. So, Today, we are talking about something that every single person in this room has the power to do, and that is to save a life. So saving a life is something that everybody needs to do, because if you watch, especially on the underdeveloped countries, you see people die carelessly, and we really need to put an awareness out there for people to to understand the basic things they need to do to be able to save a soul. You see somebody you're sitting down to chat with, all of a sudden the person just collapse and die. You just think, oh, it's village people. It's not everything that is village people. I personally, I believe in healthcare. I believe in medicine. So it depends on what you believe in. But when I see signs of things, I be able to medically or in a health settings, I be able to analyze it to see what has caused this and try to prevent it from happening. So we all know about what I'm talking about. So now today we are talking about CPR on how to save a life. Not as a doctor, you're not saving a life as a doctor or as a nurse or as a firefighter, but simply as a human being who knows what to do in the case of an emergency. In my last week video, a lot of people said I was too quick, I was too fast. They were struggling to understand me. So I apologize for that. So I'm going to be slightly slower, and then we'll still finish the normal time we are meant to finish. Thanks for joining. For all the people that are joining now, we are talking about CPR. I'll go and copy this and post it back again here. So we are talking about CPR, guys. So if you're joining us for the first time, feel free, and we will carry you along. Topic topic is, what is CPR? So that is the topic, guys. Somebody just sent a message. Hi, thanks for joining, guys. So, but simply for you to have that basic understanding on how to save a soul in the event of an emergency. Now, what is CPR? So the C, what does it stand for? C simply stands for cardio. So cardio, you all know, has to do with the heart. So when somebody says, I am going for cardiovascular examination, simply means that the person is going for an examination that has to do with the heart. Okay, so cardio in the word CPR, CPR simply means cardiopulmonary resuscitation. So I'm going to break it down so we all understand what it's all about. So cardio, the C stands for cardio, which means the heart. Then the P is pulmonary, which means the lungs. So don't get it wrong. So we've talked about the heart and we're talking about the lungs here. Then this arrow, what does it stand for? So the arrow stands for resuscitation, which means bringing back or keeping alive. So you need to understand the fact that CPR is not meant for everybody. Why I said it's not meant for everybody. It sounds weird, but I can tell you that CPRO, it's something that you have to give consent. So for us that are living in developed countries, we have what we call the red form. So when you go to hospital, or if your health professionals see that there's need for a red form to be put in place. So simply, red form simply means do not attempt resuscitation in the event of an emergency. So if that form is in place, simply means that the patient, or the POA, which is the power of attorney, or the NOK, which is the next of kin, and the patient, alongside with the health professionals, come to an agreement that this patient will not benefit from CPR. So when they say that patient will not benefit from CPR, simply means all these people I've mentioned, they've given consent for that particular patient not to be resuscitated in the event of an emergency, for several reasons. For one, for comorbidities, which is multiple illnesses the patient might have had, or also person must have had the cost of doing CPR. You know, you're talking about you are doing your CPR, you are doing chest compression. So the damage the chest compression might cause to this individual far outweighs bringing that patient back to life. Sometimes other reasons that could happen is because the patient just do not want to go through that process. Do not resuscitate me. Oh, I'm 99 years old, I've lived a good life, so if anything happens, let me just go. Some people come up with these ideas, and so there are several factors why a DNA CPR are being put in place. But regardless the factor, the patient must give consent. So when a patient gives consent for a red form to be put in place, means that particular patient do not wish to be resuscitated. So in the event of an emergency that the person's heart stop breathing, you don't do anything. All you need to do is to inform the relevant bodies, inform the families, and provide what we call comfort care for that patient, and make sure you go by the care plan of the patient or the person you're looking after. So I'm using patient, so you can always translate the word patient to your own language, say like my mom or my dad. So I'm talking to everyone in general. So if you're saying that I'm just using the word patient, but just remember it's for everyone. It could be me, it could be yours, it could be your child. So I'm just using the word general as patient. So having said that, now I've told you what the CPR is. CPR, the meaning of CPR: C for cardio, P for pulmonary, which is the lungs, the C is for cardio, which is the heart, and the resuscitation has to bring something back, or keeping something alive. So CPR basically means helping someone's heart and lungs keep working when they stop on their own. By the end of this section, you will know what CPR is, when to start it, how to do it, why every minute counts, and what to do and what to ignore, and how you can protect yourselves and your loved ones around you. CPRO, to be honest, is not complicated. A lot of people will tell you during COVID, we normally were told during COVID that we didn't have to do what we call the two rescue breaths during COVID, but there's something that was brought out that we place it in the mouth of the patient, and so if you're the type that is not comfortable doing two rescue breaths, you can as well ask for this as well, and oh, so thanks for joining, guys. Hi, Monique. Thanks for joining. I can't pronounce all your names, but I really appreciate you joining my live. And thank you for joining. Thank you for joining. Hello, love you guys. So I'm just watching all the cameras. If you see my eyes just moving or facing one side, guys, please understand. I'm just trying to watch all the cameras. So having said that, having discussed what the CPR stands for. So CPR, like I said, is not complicated. So the hardest part is staying calm. So when there's an emergency, what we expect from you guys, of what any health professional will expect from anybody, is to you is achieving schedule for running. Okay, that's fine. I'll just reading something on my Facebook screen. So in an event of an emergency, it is more likely that people will panic. But in this video, we are telling you to remain calm, because sometimes things how to do CPR. Like when I was at uni, CPR is one of the core skills that you have to do and you have to pass. So if you don't pass, you have to repeat it. And when you repeat it, when you fail it, I can't remember how many times, yeah, you get expelled. So you really have to know what the basics are, and then you don't panic, because if you panic, normally things that you just forget it. So that is why we encourage everybody to please, in an event of emergency, please kindly remain calm. And the second hardest part is the starting. So the first of all, for CPR, you need to identify that this person actually needs CPR. We have the difference between a CPR and somebody that is actually breathing, that just need a recovery position. So really need to understand the differences. In my next week section, we're going to talk about recovery position, and then we'll bring in CPR as well. How you can go from CPR to recovery position when the patient has started breathing, and then how to differentiate both. We'll do that in our next week's section. But for this section, we're going to focus on CPR because of the careless death around community in the world, especially in other developed countries. So people should understand what CPR is all about. And not just that, what CPR really means is when someone collapses, for example, or stops breathing and their heart stops, their brain is getting zero oxygen. Exactly. So after 4 minutes, brain cells begin to die. So that is why it's very important, when you identify that this patient does need a CPR, you start immediately. Don't waste more time panicking. Do not waste more time phoning the world. So all you need to do in the event of an emergency, if there's a second caller, for me, what I do, if I'm the only person in the room and my elderly parent is heart stop breathing, I quickly put my phone on speaker, Then I start my chest compression straight away. I don't waste time. The reason the phone is on speaker because I've dialed 999. So when you call the emergency line, they will be speaking while you're still doing your compression. So you are doing two things at a time. So don't wait until you phone the whole world. You phone mom, you phone your sister, you phone your brother, you phone your child, you phone this, you phone the emergency line. That will take forever. No, you don't do all that. You don't waste time. You can quickly, if you are by yourself, say for example, you have somebody else with you in the house. For me, what I would do, I try to prioritize. I need to be very smart and very quick. CPR, like I said, after 4 minutes, the human brain cells begin to die. So after 10 minutes, survival is almost impossible. So the more the brain cell starts to die after 4 minutes, and you are there spending like 15 minutes to make unnecessary phone calls, you phone the relevant people at that point. This patient do not, this particular person, oh, my mom, my dad doesn't have red file. That invariably means red form, which is do not attend to resuscitation. So that simply means that this patient automatically has to be resuscitated in the event of an emergency, and we have the emergency before us here. I start the compression, chest compression immediately. We have this 2 minutes frame. After that, you continue until help arrive. I will tell you in this video when to stop. You continue until you feel your own health is at risk. You continue until the person has recovered. Then we'll talk about recovery position. Then you continue until help has arrived. Once you see the paramedics walking through the door, don't just say, oh, they've come, they will stop. No, don't stop. Do not stop until the paramedics emergency team says, okay, thank you, we'll take over from there. Once they take over, then you can stop as well. So you need to understand the basics. It's quite intense, but then it's not as complicated as it looks. So saving a life is something that everybody should be proud of, something that everybody should know the basic awareness, follow the life creator. So CPR is something that we all need to know. We all need to understand the fact that the human brain cells starts to die after 4 minutes. So if after 4 minutes the human brain cells begin to die, and after 10 minutes, survival is almost impossible. CPR is not restarting the heart. CPR is buying time, keeping the heart alive, until help arrives. And also, if you are in the room where you have 3 people, or even if it's 2 people, for me, I'll prioritize it in a way. I start the chest compression straight away, CPR straight away. Then I will put my phone on speaker. I will phone at the same time. The phone is dialing the emergency team. Then the next person in the room, I'll tell the person to go and get AED, defibrillator in the nearest defibrillator unit. So I don't know what part of the world you are, but where I'm based, we have AED in various locations. So in fact, if you for me, I have the directory, so I check the one around my neighborhood and just tell. And sometimes even when you're lost, there are numbers you can always phone. You can phone all the emergency contact, and they will direct you to the nearest AED. When you go to the AED, all of them are locked. So if you go there, there are numbers there that you can call. Once you phone the number, they are very quick. 247, they are quick to respond to your call. When you phone down the AED, you shut it down, then you take it back to wherever the emergency unit is. So it's very quick, something you have to be very, very proactive. So once the life is saved, all these equipments are being monitored and everything is being replaced. So don't feel bad, when you're saving a soul. You are saving a soul because somebody can do that to you as well. Somebody can save you from a similar emergency. So the soul you're saving doesn't have to be your family members, doesn't have to be your patient only, doesn't have to be your children only. You're walking down the street and there's an emergency. At least it's human to be sympathetically present and be able to provide basic CPR where needed. And that is why we encourage everybody to have that fire safety awareness, first aid awareness, and CPR awareness. Very, very important, because these are the 3 likely things that you will likely use. You don't have to, like I said, you don't have to be a firefighter, or you don't have to be working in a healthcare profession. You can be anything you are. You can be an engineer. You can be anything you want to be. It can be an handy guy, but the basic thing is for you to have this knowledge. So, having said that, CPR is not restarting the heart. CPR is buying time. CPR is like being it's like being a temporal heart. So your hands becomes the pump. So the pumping that you're pumping is very, very important. Then your breath, if you give them the two rescue breath, becomes the lungs. Hi, thanks for joining, Ilechuku, Daniel. That's my in-law. I love you guys. Thanks for joining. So, like I said, CPR is like the temporal heart. So when you give them two rescue breaths, the two rescue breath becomes the heart, the lungs. Then you are keeping blood and oxygen moving until the experts arrive, and that's the paramedics team, the emergency unit arrive, or the defibrillator, the AED. So when the AED comes as well, it's self-explanatory. It's so amazing that you can just use it on your own to deliver shock. And it's something that you have to just the next person coming, depending who is more competent, can always, when the person comes with the AED, you guys can swap. At that point, I know you'll be very tired doing your compression, your CPR. You can always swap quickly after the 2 minutes round. You can swap. Person can take over, do the compression while you set up the what's it called, the AED. There, but remember, follow the instructions. When it's time for shock to be administered, you have to step away for the shock to be administered. Told the patient, and you have to follow the instructions, because the where the leads, everything goes, is very, very self-explanatory. You can never miss it. So now, having said this about CPR, so now the question here is that when should you start CPR? You can start CPR when someone is number one, if you have a pain, write it down, unresponsive. Remember, you can only start CPR when somebody is unresponsive. The person is not breathing, or breathing abnormally, gasping for breath, snoring, making strange sound. These are not normal breathing. Okay. So if the person has no pulse, only check if you are trained. Otherwise, skip this bit. Okay. So some people do not know. If you're not trained to check pulse, please skip that bit. You don't need to go into. For me, I can quickly check when somebody's pulse is sick. I can go to your carotid pulse and just quickly check as well. If I don't want to go through your brachial pulse and radial pulse, I can just go to your carotid pulse and just quickly check. But then, if you're not trained to check pulse, I would just advise that you just skip that bit. All you are there for is simply to save a soul. As a human being, you are saving a soul of another human being. You're not there as an emergency health personnel. Okay. So also, let me repeat this because it matters. If the person is not responding and not breathing normally, start CPR immediately. So if there's anything you are not taking home from today's live section, please try to remember that if someone is not responding and that same person is not breathing normally, start CPR straight away. Do not waste time. Do not wait. Do not panic. No calling your friends. Do not call your friends for help or whatever. You're wasting more time. And call for help. Call the emergency unit straight away. As you're dialing there, like I've said previously, you can put your phone on speaker if you're by yourself, and they will definitely pick the call. And while you start your CPR, important thing that you need to note is, do not need to be 100% sure that the heart has stopped. So if you are 80% sure that the person isn't breathing, begin CPR. This is because if you wait until you're sure, the person might be gone. So if you're 100% sure or 80% sure, you have to wait, because waiting kills. So checking safety is very, very important. Before you start your CPRO, you have to do your what we call, I call it the D is check for danger around, to make sure that the environment is clear, because the last thing you want to do is to you're doing a CPR in a very clustered area whereby your own safety is also at risk. You really don't want that. So that is why when you are doing your CPR, you have to make sure that you check for the hazards around the environment. And I don't know, somebody's making noise upstairs. So safety check is very, very important. Before you touch the person, make sure the area is safe, no fire, no live wires, no traffic, and so on. You are safe to also help save that person. We do not want two casualties. So we already have one casualty that is needing to be saved. We do not want you to be a second casualty, all in the name of poor start or poor practice. We don't want that. So that is why safety check is very important, and making sure this you are competent enough to do so. Sorry, guys, I need a drink. So sorry. So that is why it's very, very important. You check your safety as well, and then the area must be very safe. So if it's safe, then go ahead. Then checking for responses. Tap the person's family and shout, hi, Mary, are you okay? Wake up. If you tap the person gently and you notice that there's no response, then move to the next step, which is checking for breathing. So I look at what I use three terms that I say: look, listen, and feel. I look, I listen, and I feel. So I'm basically looking with my both eyes and to check for the breathing. Then I listen and I feel. So some people do it in a different way, but you tap the person firmly, and then you check for the breathing by look at the person's chest. Is it rising? Then you listen for the breath. Put your ear near the person's mouth to feel the breath on your cheek, and then also if breathing is normal, put that person in a recovery position. So that is what I talked about. In my next week section, we'll talk about recovery position, and I will bring in CPR, why we go from CPR to recovery position, or recovery position to CPR. I'll tell you why that is being done. Okay, so if the person is breathing, when you feel for the breath on your cheek and the person is breathing normally, then all the person needs is to put the person on recovery position. We'll demonstrate how to do a recovery position. I'll try and get a mannequin so we can just do it live. Get a table, place the mannequin on the table. I will demonstrate how we basically do what we call recovery position. It's very, very simple. So that's why I need to understand the difference. But if the patient is not breathing, or the patient is gasping for breath or barely breathing, start CPR immediately. Calling for help at the same time. Call your emergency number immediately. If someone nearby, point to them directly to help you call the emergency number. And if there is no one around you, then you have to put your phone on, like I do. You can do your own technique, because I just feel doing compression and putting your phone on, I don't think is more comfortable, because even with the compression we have, we'll demonstrate it anyway in a mannequin as time goes on. But the compression is not just anyhow compression. That will be the 5 to 6 centimeter depth. So you need to make sure that you are doing it the right way. If you are not doing the right compression the right way, the centimeter is too shallow or is too deep, remember you're causing more harm than good. So that is why you need to get it right. And then that is why this life is really, really important. So now put your hands, also if there's somebody there to help you, it's a very good start. So the person can help you call the emergency number immediately. If someone if that same person or that person is nearby, or that same person, point to them directly and they can do that for you. You say, for example, the person there do not have the experience on how to do CPR. So you can tell the person to call the emergency services now, and then people respond better when you point and direct. So even if, say for example, this happened on the road, you're just walking past and you see somebody that just collapsed, and then because you've had the training and you're competent to do so, and maybe the person is a relative, and you just go there, you don't know the background of this person, or obviously you won't know anyway, and then you sought consent from whoever that is with the person or whatever. In the event of emergency, some people, when they recover, they come back to sue you that you've damaged their ribs and stuff like that. But then the judges are lenient, because you are a passerby. trying to save her soul because you've had a training. So you shouldn't be gaslighted. You shouldn't be blamed. You should get in trouble for saving her soul, or saving her life. Hey, so you need to be very, very proactive, and you need to be very, very knowledgeable in what you're doing. So if you do not have the training, or you've had the training, you're not competent, do not start CPR on anybody, please. You only do a CPR when you've had a training, and then you feel you're competent to do so, and then you can actually do it. That is when you can go ahead and do it. So anything you've been taught and you do not know how to do it, please do not do it. Go for further training. So this is a disclaimer, and then this is a section that we bring awareness to people that CPR is not as difficult as people think. It's not something that you leave it for the health professionals to do. It's something that everybody needs to know what a CPR is, and then see how best they can use that in their own home as well to save a soul until help arrives. Like I said, you are just buying time when you're doing your CPR until the experts arrive. So the experts, they already have AED in their kit. So even they don't need to run around for AED, they already have it. They have oxygen, they have everything that the heart needs to keep running until they take that patient to the hospital. So for proper resuscitation. So in the event of an emergency, do what you can do based on your competence. Please do not get yourself go and put yourself in unnecessary danger, please. So, and if there's no one there to help you, the topic is very important for everyone to know. Yeah, thanks, Wiki. Thanks for joining my live. And so if you are normally, if you're outside, there are a lot of people that are out there that are more than willing to help you. You're in your flight, you're in the bus. There are a lot of people that are also knowledgeable that can always be there to support you. There are a lot of people that can stop their trip and make sure they deal with that emergency. There are people like that. So that is why you need to be very passionate when you are helping people. When you're helping, you don't do it out of for payback. You don't do it out of grudge. You need to love the job you're doing. You need to be able to create impact in the society, and that is what building a community is all about. So everybody creates an awareness, we all educate one another, and everything you're doing, you need to have passion in doing it. The reason why I talked about passion, because this is a life you're saving. You really need to have that passion to be able to do it. Have the zeal that, oh, in the case of emergency, I'll be able to do this, and I want to educate myself more in doing this. So it's very, very important. So it can be anybody in your family. It doesn't have to be just your family member. It can be anybody out there in the world. We're all humans, but basic understanding is very, very important, guy. So do not, how do you, how to do a CPRO? So the compression, or the only method, a lot of people know about the compression, but then we also have what you call the rescue brace. Now you place your hand position is very, very important. You knee beside the chest of the patient. So if the patient is this way, I don't know what to use. I'll get mannequin in my distance. So if the patient is as let me say 5 centimeter, you go towards, you kneel down right in front of the chest of the patient. So then you put your other arm on top of the other one. Then you lock the elbows together, then keep your shoulders directly above your hands, then you compress, then push hard and fast. 5 to 6 centimeter was what I said, and that's how the dip should be. So your compression should be normally between 100 and 120 compressions per minute. So same speed at the same time to keep that human being alive until help arrives. Don't worry about breaking ribs in that instance, because some vulnerable adults, I know when you're doing it, you'll be feeling that crack. But then, please do not worry about anything. What should be in your head is you are trying to be, you're cautious at the same time. You are not causing more damage, but be focused more on saving the soul, the life of that person, and also try to understand the fact patient walking outside, people walking outside that maybe collapse or needing CPR. Some of them do have the red form, which I said do not resuscitate. So it's a bit tricky. So that's where your clinical judgment needs to come in. So you don't know this patient, you want to help, you have to follow your instincts, you have to be very cautious of yourself, so you don't provide help that will put you in trouble. So some of these people, they have what you call the red form, but they don't carry it about, so you don't know. So your only justification in that scenario is there was no red form with this patient. patient obviously is not breathing and cannot say, even if a patient, say for example, I have a patient that says to me, maybe I went to a home visit and I saw this patient not breathing and does need CPR. If the patient says to me that, oh, I have a red form, okay, can I see the red form? Oh, I can't find it. I lost it a week ago or 2 weeks ago. In that situation, I will proceed with the CPR. So my justification for that is what is not documented is not done, and what is not seen, it's not doesn't exist. So if a patient tells me, and even if you don't have dementia, it doesn't really matter. If you tell me that you have a red form and then I've physically not seen the red form, I will go ahead with the CPR. So if I get in trouble tomorrow for doing a CPR when you've told me, my justification will be I haven't seen the red form. So anybody can say, oh, I have a red form, so the tax CPR will not be done. So and that is it. And also you need to understand that some people have consent. Very, very important. So if they have a red form in place and then they give you the consent instantly to say, oh, do not go ahead, that is a very tricky one as well. So you need to be very, very careful about the guidelines and the people's consent. Take that seriously as well. I need to see that everything is documented. If you're unsure about certain things, phone your line manager. If you do not have if this happened in a community setting where you're not at work, you can always phone the health team straight away for seek advice. But remember, the if you're talking about CPR, it has to be very quick. The human brain cell starts to die after 4 minutes. So by 10-15 minutes, recovering is almost impossible. And that is the reason why you need to really act fast. You need to be very proactive. You need to know what the guidelines and the protocols and the legislatures are. So you don't go and do things that will put you in unnecessary border. Nobody wants that. But at the same time, have the basic awareness of CPR is extremely important. So you push it to, and make sure that it's 100 to 120 compression per minute. So that continues. So like I said, do not worry about breaking ribs. It is extremely common. So even health professionals break ribs, and much more you. So, but make sure you're following the guideline, which is 5 to 6 centimeter deep. Please, very, very important. So a broken rib is better than a stopped heart. So if you're alive and you have a broken rib, I would prefer being alive and have a broken rib. So it depends on how you want to judge it. But then I think clinically, medically, I think that is obtainable. Have a broken rib and being alive. So don't stop until one help arrives. So a lot of people have asked me in the past, when do I stop CPR? Please, very important. So do not stop until helps arrive. And AED is ready. AED is a defibrillator I've told you about earlier on. So when that arrives, then you can set that up and administer the shock. So okay, so the AED is so superb. It's so good. Honestly, you won't believe how good the AED is. Hi, thanks for joining my live. I appreciate you all. And good morning. This one is just somebody just somebody's just sending me. Hi, thanks for joining, Wiki. Hi, Paul. Thanks for joining my live. So you do not stop CPR until the AED arrives, and the AED, in simple word, is the defibrillator that administers the shock to the person's heart. And then also you do not stop until helps arrive. And also you can only stop when you feel threatened, you feel your health is at stake, you can't cope any longer, or you're feeling very tired of you're worn out. In that situation, you have to look after yourself, okay? Or you stop when help somebody next to you has arrived. Not necessarily the health the emergency units, they are very quick. They are very, very quick. So I don't know what part of the world you are, but in my units, my area, they are very, very quick. So if by the time you feel worn out, they will be there anyway. So just make sure, if you're by yourself, make sure the front door is open and the entrance to the main door is open. So what we don't want is you doing CPRO, your phone is on speaker at the center, which is nice. But when the paramedics comes, they are not able to access the property. That's not what you really want. So, and be very clear in your communication with the paramedics as well. So say, for example, your on the ground floor, or you're on the first floor, you need to specify that. If there's an entry code to the ground floor main entrance, you need to also specify that as well. There are stairs or lifts, you need to specify that so they get themselves ready. So try to do things in a way that is easy for both ends as well, because the last thing you want is you doing a resuscitation, doing a CPRO, and then paramedics come, they're not able to assess you, or you give them the wrong postcode, they start looking for, no, you don't want that. So be very clear. That's why I say calmness is very important. When you're doing a CPRO, please, you need to be very calm. Okay, you need to be very calm. Normally, for me, I take forever to do things. The reason why I'm very slow in doing things, I like to get it right, because when I do things wrong, it takes me 7 days to cry. I feel so bad. I have to write a reflective account, and then I don't eat for 3 days. I feel I've let myself down. So that is why the negative impact in me making a mistake, it affects my quality of life for that period. So going through all this stress, I try as much as I can to avoid this. Even when I'm doing drug calculation, honest to God, I have my calculator that I have to use. Then I use my phone mobile calculator as well to make sure I have the same unit of measurement, the same what's it called, meals. So I do not want to take any chances. But the last thing anybody wants is to do a wrong drug calculation or to do a wrong CPRO and put somebody at risk. It is extremely unprofessional. So you have to work by the code. You have to make sure you go by the guideline. Like I said, if you are unsure about something, or you've had a training and you're not confident, speak to your line manager, go for more training. I do a lot of training that I call CPD. Majority of those trainings I pay by myself. The reason I pay for those trainings by myself, because I want to develop my knowledge in certain areas, not for promotional reasons, but just for my personal knowledge, and to be able to provide person-centered care to people around me, not just my family members, not just for patients I look after, but for friends, for people, passerbys, for the public in general. So you need to be community oriented, and you need to have that passion and the zeal to save a life. You need to make positive impact in your community. So what are you known for out there in your community? Are you known for a gangster lifestyle? That's not what we really want. So if you are passionate about saving soul, you want to take your career to the next level. So I think being compassionate is absolutely amazing. Love what you're doing and be dedicated, be consistent, and make sure anything you're doing, put yourself first. What I mean, put your first first. Just put yourself to say, if I'm doing this to myself, if somebody does this to myself, how will I feel? If you think you will feel good, then that is the right thing to do to others. And if you feel somebody does this to you, oh, I will not feel bad, then I will feel bad, then do not do it to somebody else. So that is why I said compassion is very, very important. You need to have self-love. You need to love people, have that genuine love for people, regardless who they are. And when you're providing life-saving therapy like CPR, please, 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 you go by the guidelines and make sure you are working by the book. You do not have to be health professional, but you need the basic knowledge to do a simple CPR. Somebody got drowned, for example, and they luckily got rescued. Some people get rescued and they end up dying at the river shore. They have been rescued, which is great, but they need simple CPR to keep the heart going, which people ignore, and they just take them to different places, or they just act ignorantly, and someone that has been rescued from the river can't be given CPR straight away until help arrives, So it's really, really shocking. The tiniest of careless deaths around the globe. It's so appalling that CPRO, it's a life, a game changer for every household to have that basic knowledge, honestly. So like I said, fire evacuation techniques is something that everybody needs to know. Have that basic fire awareness training, CPR training. Some people call it basic life support. You need that training. Then also first aid. In the event of an emergency in the house, you need simple first aid. Say, for example, you're bleeding, your your hand is bleeding, what do? You have a running nose, you have a bleeding nose, what do? You don't let the person bleed until help arrives. No, basic first aid is really, really important. So we'll be breaking down this in different sections and every weekend, and to make sure we bring a lot of awareness to people and to be able to educate people and to make sure we are all on the same page, and then see how we can help promote and then save souls in our society. So now let's go back to this thing. It is extremely common when you see people panic, and we tell people, please, in the event of an CPRO, please do not panic. Okay, do not panic. And just on your own, try to find out. Like I said, a broken rib is better than a stopped heart. So don't stop until help arrives. AED defibrillator is everywhere. On your own, try to find out the nearest defibrillator around your home. You might need it. Okay, you might need it. Please. So try to find out the nearest defibrillator. There are key numbers that you should have on your phone. I use what I call the three words on my phone. I have the app. You can download that as well. You can have key emergency numbers on your phone, so when you need them, you can always dial them straight away, so you're not struggling to do anything. You just dial straight away. And please, you need to be aware, once the person once you do a CPRO and the person starts breathing again normally, in that situation you have to stop. Yes, stop the CPRO. Then you put the patient back on recovery position. So now, going back to CPR, if you are too exhausted, you can only stop it as well when you are too exhausted. So now we have what we call the breathing option, the rescue breath. Compression only is compression only. The CPR is effective. However, you can add rescue breath if you're trained. How to give the two rescue breath? Tilt the person's head backwards, and then make sure you lift the chin as well. So if you are tilting the head backward, you lift the chin as well of the patient, and then while you're doing that, you now pinch the nose of the patient, which is like this. Then when you pinch the nose, you now give two slow breaths. So when you give the two slow breaths, each breath should last at least a second, guys. Don't get it wrong. Each breath should last, please, up to a second. Then chest should rise visibly. So when you give that rescue breath slowly, you can see the diaphragm rising, the chest is rising and down again. So you should be able to visibly see that. That shows you are giving the first rescue breath successfully. Then after you've seen that, then go back to the 30 compression. So don't forget, you do 30 compression and the two rescue breath. Okay, so just get that in your head or put that down in your pen, in your paper and in your notes. Then you do the 30 compression and two rescue breath. Then you repeat the cycle again. So the first cycle should be able to take you up to a maximum of 2 minutes. So that is why, like in my OSCE when I was at uni, if your rescue breath is not up to 2 minutes, let me say 59 seconds, obviously you were too quick. So that will tell you that you were way too fast. So that is why it has to be slow and steady. Your depth has to be 5 to 6 centimeter, and then your per minute has to be 100 to 120 per minute. So that is why you have to be slow and steady, not too slow, not too fast, but you have to follow the guideline. So if you follow the guideline, the first cycle should be able to take roughly about nearly 2 minutes or 2 minutes. So that will give you a guide that yes, you are within the right pace. So just put that down in your notebook as well. So if unsure or uncomfortable with the breath, compression only is absolutely okay. Like I said, during COVID, a lot of people didn't want to do rescue breath. It is absolutely acceptable. You don't have to do it if you feel uncomfortable doing the two rescue breath. You can just carry on with 30 chest compression. Okay. So what is an AED? So AED stands for automated external defibrillator. So a lot of people will be wondering what I mean by AED. So I'll just put it in the comment section here. AED, automated. It's in small letters. Let me just AED. I put them in small letters, guys. Just pardon me. Just take it the way it is. So automated external defibrillator. Hi Kelly, thanks for joining my live. So I've just put on TikTok comment section what AED stands for. So AED stands for automated external defibrillator. It is a small box that talks to you. Like I said, it's self-explanatory. It tells you exactly where to put the pads on the chest. So normally we put one here and we put one here, but it tells you the photograph is there and it talks you through the process. So it's self-explanatory. It tells you when to stop, when to leave the patient, and when the shock is going to be administered and when to commence. Okay, so it's very, very self-explanatory. It shows you pictures, tells you exactly where to put the part, analyzes the heart, decides if a shock is needed, gives the shock automatically. It does not shock if the heart doesn't need it. So that is how good the AED is. So the person doesn't need that. If the person's heart doesn't need it, it will not. So that is why it is extremely safe. So if there's an AED nearby, get it ready, use it immediately. Why every second matters, please. So every minute without CPR reduces the survival of and the chances of survival of this particular patient. So that is why it is very important that you use the AED. Know where your nearest AED is around your home. You might need it someday, but even if you don't need it, just try to know where your nearest AED is. Like for me, my nearest AED from my home is about less than 5 minutes. So it's something that is very, very close. They have AED in strategic positions, like I said. So you don't need the key to access it because it's locked. There's a number there. You need to, when you go there, you dial the number straight away. So when you're going, go with your mobile phone. And even if you get there, you forgot your mobile phone because you were panicking. That's why I said calmness is very important. Before you administer CPR, make sure you're extremely calm. You are, if you are calm, you'll be able to do a lot of things. And then you are not, hi Lola, thanks for joining my live. So when you get there, even if you don't have your mobile phone, you can speak to someone next to walk up, passerby. People are so passionate. People are really, really kind by nature. So passerbys can even say, please, could you dial this number for me, please? I left my mobile phone. There's an emergency. Every person will be able to, every human being with a kind, loving heart will be able to assist you. So don't feel, oh, I left my mobile phone in the house. Let me go back and get my mobile phone. You are wasting more time. So just try to get the AED and then make sure you go back and save the soul. So now there are a few things I'll talk about shortly. But then, like I said, every 5 seconds, every minute, every seconds count. So every minute without CPR reduces the chances of the person up to 7 to 10%. So that is why you need to be very quick. But CPR doubles or triples the chance of survival. So your hands right there on that person's chest are the difference between life and death. So why the other person is a way to go get the AED from the nearest station, you that is doing the CPRO, continue with the CPRO, please. Because if you do not, it's just a common sense. If you stop the CPRO, please, if you stop that CPRO, the person will be left to die, and that's not what you really want. So, hi, thanks for joining my live. Thank you so much. So, hi, for those that are joining us just now, we are talking about CPRO. We've gone ahead to describe what the C stands for. We've said the C stands for cardio. Cardio has to do with the heart, and that is why when you say somebody that I've gone to see my cardiologist or I'm going for vascular examination, that means you're going for an examination of your heart. So we also talked about what the P stands for, guys. So this P we said is pulmonary. We all know about the pulmonary vein and the arteries, guys. We majority of us done biology. So that simply pulmonary has to do with the lungs. And then the resuscitation simply means bring back. So that's why we join the three words together, which we call the cardiopulmonary resuscitation. And it is just basically when somebody's heart stop breathing, you try the best you can to start the CPRO to bring the person back to life. So that is summary of what we have been discussing, guys, all this while. And then thank you for joining. So like I said, CPRO triples, doubles or triples the chances of survival. So your hands right there on the person's chest when needed to start the CPRO, it's the difference between life and death. So now I will mention 4 things that you must not do or do. So the first thing is, some people will say I will get sued if I do CPRO. So my answer to that is, most countries have good Samaritan law that protects helpers. So don't get that twisted. Most countries have good Samaritan laws that protects helpers. So say for example, I went on holiday in Italy, and there's this so basically I'm a passerby and there's an emergency. Because I know I'm competent in doing a CPRO and I've got the training, I really want to save a soul. I'm so passionate about my patient, honestly. I am so passionate about human being in general. So I love to help. That is, I don't know. So I don't know if everybody's like that, but then I believe everybody should be passionate about helping. So I can't just watch. I can never watch a passerby, however late, even if I'm taking my child to school, and my child we are running late. I'd rather I run late to uni or I run late to work than I do not save a soul that obviously I will normally, save. No, I won't do that. So the choice is yours. I just feel we should all be compassionate. We should all have love for one another. So don't get it twisted. If you're a passerby and you see an emergency, please do not walk away. Try your best. If you feel you're competent, you've had a training and you're competent in saving a soul, please go ahead and save a soul. So do not have this ideology that people says, oh, I'll get sued if I break the person's ribs. Please do not have. If you have that mentality, you will never save a soul. And you just watch people die on the road. We don't want that. So please do not feel that you get sued, because most modern countries have what we call the Good Samaritan laws that protect helpers. So if you try to save a soul, like you do a CPRO, or you're a passerby, you do a CPR, you see, an emergency, you do a CPRO, and something goes wrong. So for example, the person breaks his or her ribs, and the family wants to sue you. So there are countries that have Good Samaritan laws that protects you. So just know that that law is there. And then so do not restrict yourself from helping. And also, another question I want to ask is, I need training to do CPRO. The thing there is that no. So if someone is dying, you do you do you do something? Say for example, if somebody is dying now, you do something. Emergency operators can guide you. So you need your basic training for your CPRO, and then and also you need your basic competence as well. So it's not just you having the training, you need to be competent. Because if you've got the training and then you don't feel competent, please do not attempt it. You only do things. Say for example, for me, when I had my syringe year syringe training, I had all my competencies done, the required competencies done. But I said to my colleague, you know what, I need more competence. Can I just do a few more? So you are allowed to do all this. Don't put yourself in a position where you need to be very confident in what you're doing, and you need to be extremely professional in what you're doing. And remember, you're dealing with human soul. So you're going to do year syringe, and then you had the training, you've had all your competencies done, but you still don't feel confident. I wouldn't be doing that. I will rather channel my energy to see how I can get more competencies done to boosting my confidence level, because you're dealing with human eardrum. You don't want to go and damage the person's ear, or you finish your ear syringe, person starts bleeding, or there's a sore there that leads to infection and stuff like that. You really don't want complications. So you have to be very, very mindful when you're dealing with patients in general, or anybody you're looking after. Make sure you have the required competence level and the confidence to be able to do it, and then be able to document what you have done. So very, very important. So the number 3 question. Hi, thanks for joining. Hi, Leonard Young, for watching my live. So For those that are joining us, we're talking about CPRO, how CPR is very important in our families, how we need the knowledge to be able to help our loved ones, our children, our friends, and even passerbys on the road that just, or in the bus, in the flight, in the ship, anywhere we find people that need CPRO, we should have that basic knowledge of CPRO and be able to, bring them on video. Okay, that's fine. So send request. So anybody that wants to unable to add guests, okay, that's fine. I'll add you guys. Yeah, I'll add it to my guest list next in our next episode. The topic is very interesting. Okay, thank you guys. So like I said, so do not be scared that when you help passerbys to hi, thanks for joining, guys. Thanks for joining. So I've got a lot of messages, guys. So I'll just be typing as I go along. So having said that, CPR is very important in our life, in the life of our loved ones. The knowledge that we get and we're able to impact it to save souls around. So the topic is about save a life. How do you save a life when you don't have the knowledge? You save a life when you've got the knowledge, and then you are. I don't know. My volume is not. I don't know. I think some people are not hearing me. My volume is really down. Sorry, guys. Anyway, I don't think people on Facebook they're hearing me because they're complaining seriously. Anyway, I just hope they are hearing me now. My volume was really down. Sorry, guys. So it's very, very important, guys. So we have that basic knowledge of what we are doing, and then, like I've said, for those that are joining us to just now, we talked about CPRO. CPRO C stands for the heart, and your heart is like a pump, and then when it stops, blood stops moving, then the brain is starving of oxygen. So that's why CPR replaces the heart pumping. And then we also have what we call the P. The P stands for pulmonary. Pulmonary simply means the lungs. Your lungs brings oxygen into your body. So if the lungs stops, blood has no oxygen, and we really don't want that. So hi for joining my life, family, and sickle cell. Thanks for joining, guys. Thanks for joining. Yeah. So thanks for joining, guys. I really appreciate the number of people joining us today. That's amazing. So I'll just put the description here. Sorry, guys. So CPR. Somebody's asking me about the description of. I should put the description. So I'm just typing that CPR importance. Sorry, guys. I'm just typing. So your life will end in 4 minutes. So what do I do? Drag the so that's the same verification. I don't know why TikTok does verification all the time. So I've just done the verification, so I think we are fine. So somebody's asking me to send what the topic is all about. So CPR importance. Anyway, I've sent it. I think I even typed the importance wrongly. Anyway, so that's fine. So for those that are joining us for the first time, we are talking about CPR here. We said the C stands for the cardio, which means the heart. Your heart is a pump. So when it stops, blood stops moving. The brain is starving for oxygen. And then, so the CPR replaces the heart pumping. So, and then we have the P, which is the pulmonary. The pulmonary stands for the lungs. So basically when your lungs brings oxygen into your body. So if the lung stops, blood has no oxygen. So rescue breath helps deliver oxygen when needed. Then the R stands for the resuscitation, which means bringing back. So this is a act of reviving someone or keeping them alive. So CPRO keeps oxygen flowing. Then AED, I've talked about the automated external defibrillator, restarts the rhythm if needed. So together they form the chain of survival. So now we all have what we call the signs of cardiac arrest. Like I said, cardio has to do with the heart. Cardiac still has to do with the heart. So now cardiac arrest, like you know what I mean. We're still talking about the heart here. So now, what are the signs of cardiac arrest, guys? So the first thing, the sudden collapse, when somebody just automatically just collapse, that is a sign. Then number two, somebody stop breathing. So I'm not going to mention names here for due to confidentiality, but then I cannot tell you for free. I've had stories in the past where somebody just phoned me, oh, we're having a chat with Mr. A. Mr. A just collapsed and died. Instantly, I knew that was a cardiac arrest. If the people around Mr. A had done simple CPRO, one has commenced CPRO, maybe the other person is calling the emergency unit, and the third person has gone to get the nearest AED, that person will be alive. So some people do not believe in medicine. Some people just feel that anything that happens to you is traditionally related. I really don't believe in that. I just believe there's a reason for everything in this life. So that is why we have to be very, very careful. So one of the signs of cardiac arrest is sudden collapse. Number two, no breathing. So when you've done your look, listen, and feel, there's no presence of breathing sounds. You cannot feel it and you cannot see it. The diaphragms of the heart is not moving, so you should know that there is no breathing. Then gasping or snoring has how sound, no movement, no response. When you shake the person, hi Mary, are you okay? The person is not moving. Then you should know that there's no response. Then blue or pale skin. If the person turns blue, just all of a sudden, no breathing, sudden collapse, no movement, no response, the person turns blue or pale skin. If you see these signs, please, please, please start CPR immediately if you are competent to do so. Now, special situations will be, say, in children, they have their own specific instructions. Please, for children, they have specific instructions on how to go about their CPR, and you need to make sure that for children you give 5 special rescue breaths. CPR with 30 compressions and 2 rescue breaths comprises 1/3 the depth of the chest. Then for babies, please use 2 fingers. For babies, you use just 2 fingers, please. Don't go and rip a child's chest, please. Don't go and scatter a child's chest, please. For babies, you use 2 fingers. Gentle compression, please. 30 compression and 2 rescue breaths. Then for patients that are drowning patients that have been rescued, rescue breaths are very, very important because the lungs are filled with water. I made that situation. I talked about the drowning patient. The reason I talked about the drowning patient because of stories we've had in the past. A patient was rescued from the river, and this patient, at the time of rescue to the shore or at the shore of the riverbank, the patient was still breathing at the time. This patient needed what we call the CPR instantly, immediately, by anyone those that are taking photographs and making videos. Any of them that there would have like stopped taking videos. Taking videos and photographs is not the priority. Somebody competent in that crowd would have come up to do a CPR rather than transporting this person from one hospital to another, one trado medical center to another, wasting time, because this patient's lung is filled with water. So rescue breaths are very important for drowned patients that have been rescued, drowning patients that have been rescued. Rescue breaths are very important because the lungs are filled with water. Also, we have what we call the trauma. Focus on CPR. Don't move unnecessarily. Then for pregnant women, please place your hand gently, slightly higher on the chest. The recovery position, please be very, very careful with pregnant women and babies. Please. It's not something we're going to discuss here, but please, please, please use this if the person is breathing but not fully conscious. Please make sure you put the person on recovery position if the person is breathing but not fully conscious. But be very, very careful when you're dealing with pregnant women, please. So, and also the steps that you need to take in doing that, you have to kneel beside them, you have to straighten the legs. Anything you're doing, you have to be extra gentle, please. Place the far arm across the other chest. That's if you're doing your recovery position for a pregnant woman. Then bend the knee, the far knee, and also roll them forward to you. Okay, keep them forward to you. Please tilt the head backward to keep the airways open and patent, please. and be very, very gentle. When I mean tilt the head, you put the head backward like this and you tilt your chin upwards, and to make sure you keep the airways beating. So now let's talk about the emotional side of CPR. So we've talked about what CPR is, what it does, the importance of CPR, and then now let's talk about the emotional side of CPR. Doing CPR can be stressful. It is. I've done a CPR and I can tell you for free that it is stressful. Okay, so it's not complicated, like I said, but it is stressful in some way. So people shake, and sometimes people cry because if you're doing a CPRO in an environment where there are people are shouting, screaming, crying, these are distractions. Okay, so you really need to stay focused. People feel fear, fear of the unknown. When I mean fear of the unknown, oh, what if I break her ribs? What if I get sued? These are the things that people consider, and then people tends to fear. So that is why I talked about, please, you need to remain calm. But something amazing happens every time. Your body switches to help mood. In the midst of your anxiety, your restlessness, your fear, there's this thing that comes into you, and that's your mood. Your body automatically changes to help mood. If you're that type that is compassionate and passionate about your what the job, what you want to do, about saving soul. So when I mean job here, I'm not talking about our individual job here. I'm talking about save a life. That is the job. So that is the job of everybody. That should be a job of everybody, to save a life, in your home, anywhere you find yourself, to make sure people around you not just feel safe, you are able to provide first aid um, help to save their life, in the event of an emergency. So now, also, your heart races, but your hands do the job. Okay, despite the fact that your heart is racing as you're doing your compression, you have so many thoughts within you. But then I can assure you, if you get focused on doing the 30 chest compression and your 2 rescue breath, and focus on the person you're performing the rescue breath on, all the side distractions like the noise, the cry, the wolverine and all that will it's not going to get to you. So just focus on what you're doing, and keep doing what you're doing. Okay, your heart races, I know, but your hand does the job. And then afterward, whether the person lives or not, remember, you gave them a chance to live. So even when you do a rescue, your chest, perform CPRO, and the person ends up not surviving it, just get this straight: you gave them a chance to live. Okay, that is commendable, that is bravery. So you really need to be very proud of yourself that you've done a very good job. Don't feel overwhelmed. I know it's emotional. You tried your best and the person didn't make it. Even in the ward, even in hospital, in acute setting where we do resuscitation in resource unit, some people don't make it. Some people make it. So it's really, really emotional at that stage if they don't make it. If they do, it's a thing of joy, to talk about, to be proud of, But if they don't, so don't get yourself don't put yourself under the bus. Don't feel so sad if they don't make it. All you need to do is just to keep trying your best, and remember, how long we are over an hour, so we'll be wrapping up shortly, guys. So hi Chami, hi Royal underscore so, hi Dixon, hi Ashabi. So hi guys, for those of you that joined us just now, we are talking about CPRO. So we talked about what CPRO is. That CPRO simply means cardiopulmonary resuscitation. We went ahead to explain what the C stands for. We said the C stands for cardio. Cardio has to do with the heart. And then we also talk about the pulmonary, which you already know. The pulmonary stands for the lungs. And then the resuscitation stands for bringing back to life. So when we put all three together, we now have what we call the cardio pulmonary resuscitation, which simply means somebody has stops pumping, we use what we call we do what we call the CPR, which involves the 30 compression and the 2 rescue breath. So the compression pumps the heart to make sure the heart keeps life alive, and then the lungs, when we do the rescue breath, it works on the lungs to make sure the person comes back to life. And then we are doing this to buy time until we are able to lay our hands on AED. While that is being done, we are already on the phone, already to emergency unit. Depends on what part of the world you are. You should have a directory in your phone where you have your emergency contact details. So in the event of an emergency that you need to perform a CPR, all you need to do, you put your phone on speaker, call the emergency unit, start with 30 compression and 2 rescue breaths. While you're doing your CPRO, you're still chatting with the health professionals on the phone, and in no time they'll be there. So remember, we talked about the human brain starts to die after 4 minutes once there is no circulation of blood. So the human cells in that situation, when the person stops breathing, starts to die within 4 minutes. So if you're wasting time to start phoning the relatives of this person, try to find out more details about this person, try to panic, jumping around left, right, and center, unsure what to do, please remember, after 4 minutes, the human cells naturally starts to die. So if the human cell starts to die after 4 minutes, so by 11, 15 minutes, the person's situation is not reversible. At that stage, it is impossible to revive that person. So that is why you need to start CPRO straight away. When you're starting CPRO, at the same time on the phone to the emergency unit, and the other person is able to get the AED. The AED, we call it the automated external defibrillator. This is an equipment that helps to deliver the shock to this patient. It can only deliver the shock if a shock is needed. So if the shock is not needed, it will not deliver. So it is very, very self-explanatory and a very powerful tool, and it is a life-changing equipment. So like I said, apart from having the local directory contact, emergency contact on your phone, you need to also know your nearest AED, where you need to go, how to access it, talk about it as well. That you don't need to worry about anything. When you go there, there are numbers on the AED there, on the body there, outside the box there. You dial the number, they will give you a code. You use the code, open it, get it, and shut the place and take it back with you. So some people have asked me, oh, when the AED arrives, do I take it back and put it back? No. So the thing there is that because health practitioners are coming in, paramedics are coming to see this patient anyway. So I can tell you for free that because the person performing the CPRO is already on the phone with the paramedics, normally before that phone gets through to the end, paramedics are already on their way. And like the call handlers, part of the region I'm from, the call handlers, they'll be on the phone until help arrives. That's how good they are. They are amazing, brilliant. And the paramedics are so quick to respond. So you'll be on the phone, the call handler will be with you on the phone, tell you if there's any changes, just let me know. I'm still here. I'll be here until the paramedics. So once the paramedics arrive, then they can hang on. Okay, you now deal with the paramedics. So it's very, very quick. So I can tell you, by the time the second person goes to get the AED and back, the paramedics are already there. So you don't need to take the AED back to the box. All you need to do, you hand it over to the paramedics. They will take it with them. There's a code, there's a number there. So whatever hospital that patient is being taken to, it goes over there, and they know how to send it through internal mail back to medic physics, where they go back there. If it needs services or it needs batteries being replaced or it needs sterilizing, they do all that and they send it back to the same unit where you took it from. So they are so efficient. So please, for those that have messaged me, asking me how do I send the AED back, please, you do not need to send it back. When you bring it out, whether it's being used or not, hand it back to the paramedics that visited. But in a situation whereby you go back, and there's always a guideline. If you're unsure about anything, there's the number that you call that gave you that code to get the AED. You can phone them back there. Oh, I've got the AED, I've gone back, but on getting back, the paramedics they have done everything they need to do, and they're taking this patient away. So I'm left with the AED with me. What do I do? They will guide you on what to do and what not to do. But normally, these equipments are being sterilized. Whatever parts that have been used, they will sterilize, they will replace everything, check everything to make sure that it's working perfectly okay, and they will put it back. So I'm not expecting you all, they will not be expecting you to go and put it back, but they can always guide you on the best procedure. But if you're unsure about what to do, if the paramedics are still there, give it to them and they'll take it with them, and they know how to send it to medic physics to get it serviced or sterilized or replaced, and they know how to send it through internal mail back to the people that will send it back to where it's the right unit, and they'll send it back. So it's us to do it within the system, so don't worry about that one. So for guys, so that's what we just talked about. And also we said, please be confident, know about what CPR is all about, have your basic knowledge of it, your basic training of CPRO, and be able to make sure you have what we call competence, high competence level. What we expect anybody doing, if you have that knowledge of training or knowledge of CPRO, make sure you are competent and confident in doing it, and make sure you're following the guideline. Like I said, for the CPRO, in the nutshell, it has to be, the compression has to be 5 to 6 centimeter depth, please, and your this thing per minute has to be 100 to 120 per minute. And then the first cycle of 30 compressions and the 2 rescue breath, the whole cycle should take you roughly about 2 minutes. So if you're if you're about 1 minute, then that should give you an indication that you are too fast. If you are 3 minutes in the first cycle, that should tell you that you're way too slow. So that is a rough guide. So if you are 1 point, let me say 40 something, that is, I think, okay. So you're nearly the 2 minutes, you're not there, but then that shows that you're within the acceptable parameters. So make sure you're working by the guideline, because the one thing we don't want people to do is, you're doing a CPR, you think you're doing a CPR, but you're totally doing it the wrong way. So that is why I talked about the awareness, the training, the competence, and the confidence. Okay, and make sure you're doing it the right way, please. Very important, you're doing it the right way. If you're not doing it the right way, you're causing more harm than danger. And also, when you're doing a CPR, please remember, any part of the world you're from, we have what we call Good Samaritan policy. The Good Samaritan policy protects passerbys and Good Samaritans, helping people on the road. Maybe they are going somewhere and there's an emergency, they feel they've got the competence to do a CPRO, and they perform a CPRO, and for some reason the person never survived, or some person did survive and the family decided to sue you. So please do not be scared that you get sued. What you're doing, you're a Good Samaritan. You don't know this person from anywhere. That person doesn't know you. You are just a passerby. You've seen an emergency, and then you felt you are competent enough to do so. You've got that passion to save a life. If in the event anything goes wrong, please, they have what we call the Good Samaritan policy in some part of the world. You can always research the country you are to make sure you get yourself guided, and then do not allow that to stop you from saving a life, please. Saving a life should be everybody's job, should be everybody's game, should something that everybody should be compassionate and proud about. And it's not just for your family members only, it's for anybody around the globe. Okay, so we're going to be summarizing shortly, guys. So in summary, guys, so I will just say, you know what, don't let anything disturb you. Go straight to your help mode and help. Your heart races, I know, but your hand does the job. And afterward, whether the person lives or not, remember, you have tried your best. So you give them a chance. Your bravery is commendable. And thanks for joining, guys. We are talking about CPRA, importance of CPRO, and then that is where we are. So we're just summarizing, guys, and then we'll be finishing in no time. So now, in summary, I would say, let's repeat the essentials. Please check for safety. In summary, before you commence a CPR, please check for safety. Check response. Please, if you have your pen and paper there, write it down. Check response. Check for breathing. How do you check for breathing? Please, I've talked to you about check for safety. Safety means you're checking the safety of the environment where you are, to make sure there are no hazard, no clusters, no light, no water on the floor, no trip hazard and stuff. And make sure you keep yourself safe. You are trying to save a soul, which is fine, but the last thing we want is to put yourself in danger. So please do not put yourself in danger. If you don't feel competent, do not do it. And if you feel the area is too decluster the area, make sure the place is safe enough. We don't want you doing the CPR in a very tight corner. At the end of the day, you get trapped, or a hard object fall on you and you get injured. So we now have 2 casualties. We do not want that, please. So you need to be physically fit to be able to save the life of the other emergency patient who've got on the floor. And then please You have to check for response. You have to tap the person gently, call the person's name to make sure, are you okay? Can you hear me? What's wrong? If there's no response, then you have to check what we call the breathing. We look, listen, and feel. Check the diaphragm. Use your chin, go around to the person's nose or mouth to see if you can feel breath sounds, and look, listen, and feel. And also, you call emergency services immediately and start CPR. You can do both together. Start CPR immediately, and at the same time call emergency unit, put the phone on speaker. The reason being that you cannot put your phone in your ear and be no, you will not be and be doing CPR. No, CPR requires you to be upright, and you can get that 5 to 6 centimeter depth. That is a protocol. Okay, so, and make sure if there's somebody next to you there, get the person to get the AED for you to use. Don't stop until help arrives, please. CPR, like I said, is very simple. CPR is a powerful life game changer that can save soul. CPR saves lives, please. So for closing remark for today, I will just simply say every person sitting here right now has the power to become a lifesaver, please. If you, and a lot of people have joined me here for over an hour now, and thanks for your patience. But I can assure you that all of you watching me this morning here, you have the power to become a lifesaver. You don't need superpowers. So all you need to do is to have that confidence, be competent in what you're doing, believe in yourself. You don't need medical school and knowledge. You don't need medical school or nursing degree to be able to do what we call CPR. No. All you need is your basic training, be competent, and have that confidence to be able to save it. Have that passion as well to be able to save a soul. So now I'll wrap up by saying, please, 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 you just need courage, your hands, and the willingness to act. That's why I talked about the passion. So you need to be able to have that passion. You need to have that self-love. You need to have that love for another. You need to be empathetically present. You need to be empathetic. And you don't just see an emergency on the road and walk away. It is really not nice. Some people do that for several reasons I've mentioned, because they don't want to get sued, they don't want the family, they don't know the person has got a red phone. For those that are joining us for the first time now, just joining us now, like me, Miri, and so a red form simply means from the part of the world I am, we call a red form do not attempt resuscitation. So if you have a red form in place, simply means in the event that your heart stop breathing, nothing will be done. We will not resuscitate you. So that form came into place because the medical doctors or the medical team has had a discussion. They've had a discussion with this patient, and then they've had that same discussion with the family. When I mean the family, whoever that is the next of kin or the POA, power of attorney. So they've had this roundtable entity discussion, and they've decided that attempting a resuscitation on a 98-year-old male will not be in his best interest, or for age reasons, or for comorbidities reasons, or for several other reasons, or for the patient's choice. So patient's choice has to be respected. So if a patient say, I do not want to be resuscitated in the event of emergency, say my heart stop breathing, there's no reason for that decision. It is my choice. Then that choice has to be respected. That choice get translated into the red form, which we call the do not attempt resuscitation, because this patient do not want to be resuscitated. So in that situation, if you go, that's why when you're working with any patient, you need to find out if they got AWR in place, adult with incapacity, or if they got DNA CPR in place, which is do not attempt resuscitation. If they have these two, you need to make sure the patient you're looking after, you read their notes. You don't just start working on people. You make sure you've read their notes, and also you uh, are 100% sure they've got this in place. If they have it in place, try to physically cite it. And that's why when they are going to hospital, they take this form, the original copy of the DNA CPR with them. That has to be cited. So in the event that you do not cite, or you cannot visibly see the red form of any patient, please, when an event occurs like this, if you're unsure whether to commence CPR or not, In an hospital setting, there are several helps. When you call the emergency unit, they come. There are team of doctors, consultants, and AMPs and stuff. They come in an emergency situation, which is quite helpful. So you really don't have to do much. But you're in a community setting, you seek advice straight away. If you have not cited the red form, you treat it as though the person do not have a red form. If after the whole procedure, this CPR procedure, the person finally finds this thing, then your justification for doing a CPR, when the person verbally told you, I have a CPR, I have a red form, but I could not find it. So if the person says, I have a red form, but I could not find it. So obviously that person, if you can't see it, meaning the person do not have the red form. So you have to treat it as though the person do not have the red form. So that is your justification, and you will never be penalized. So you need to understand the guideline, and you need to work by the book. They do what is written in the book, and always keep yourself right. Okay, so don't just take anybody telling you, oh, I have a red form, and the person does need a CPR and you're not giving CPR. That will be classed as negligence of duty. Remember, you owe that duty of candor to be able to provide the basic care they need. So you are knowing fully well this patient needs CPR and not providing it is negligence. Simply because the patient told you, oh, I have a red form. But the red form, you've checked on the notes, there's no way it's written on the system. You've physically looked for it, you can't find it, and the patient cannot even find it. And you're taking the person's verbal word for which can be deniable. So please keep yourself right. Treat it as the person do not have a DNA CPRO and carry on with your CPRO. But if the person has a red form and is all fully signed, make sure you're reading the red form, not just seeing physically, you're seeing just any red form. Make sure it's been filled correctly and it's been signed and dated. Any concerns, please you raise that up straight away. Okay, don't just see it from afar. So, oh, that's a red form. It could be a blank red form. So that is why you need to be very, very alert and make sure you know what you're doing and watch. Always make sure you do as per the protocol and the guideline, please, to keep yourself safe, out of border, and also safe as soul. So, in summary, guys, all you just need is your courage, your hands, and your willingness to act. One day it might be a stranger or someone you love, and on that day you will be ready to provide CPR. So, in summary, guys, we talked about CPR in details. We talked about the signs. So, when you see somebody fall suddenly, looking blue and pale, stop breathing, then you know CPR is required. Please, a drowning patient, for children, for pregnant women that needs, please follow the guidelines. Please make sure you follow the guidelines for CPRO. Like I said, what CPR is all about. CPRO simply means cardiopulmonary resuscitation, and make sure that you have the level of training and competence that is required to do a CPRO. All you just need is a basic training, and you need a good knowledge about the CPRO, and you need your competence level must be up to high standard. So remember, you're not just doing CPRO, you're going by the guideline. It has to be 5 to 6 centimeter deep. Then it has to be 100 to 120 per minute, minutes per minute, and please seconds per minute, and you really need to make sure you're working by the guideline. Okay, thank you for joining. For those of you that are joining me now, please, this is Chrysanthus Investment. We come on once a week here to do live on all the channels: YouTube, Facebook, Instagram, and TikTok, to give you about knowledge about health. We are also open for communication. Feel free, if you've got any questions, put them in the chat box and we'll respond to your questions, or you can DM us as well. We have resources that we can give out for free as well. So that we have a lot of resources on our stand store. If you go there, you can see a lot of health related, how to keep yourself right, how to prevent diabetes, ulcer management, so many things like that. We have so many things that you can benefit from this channel. We talk about mainly talk about health. So our channel is into property investment, digital marketing, and sustainability. In sustainability, we talk about the energy and we talk about the health. So the health bit is what we bring there live once a week to talk about different types of diagnoses, how we can help one another, what we can do to save our soul. And this brings us to the end of our session. And thank you for watching. Wow, this is amazing. Thanks for the turn up, guys. An hour 30 minutes. I think that's the longest I've done so far. Thanks for watching, guys. And that brings our life to a close. Thanks for watching. Here we go. Thanks for watching. I will see you in my next live. All right, guys. Thank you for watching. Bye. I will see you in my next live. Thank you for watching, guys. And I will see you in my next live. Bye. Here we go. Oh, thank you. So thanks for watching, guys. So end live now. So I'm going to end this one here as well. Thanks for joining my live. So that's the end of today's section on CPR. That's the end of today's section of CPR. So I'm gonna take this off now. Oh, and your stream will stop immediately and you will no longer be live. Yes.